So um, let's go ahead and get started. I guess Luke, you can go first. If you want to tell us a little bit about yourself and what you've been working on for the last many years.
Yeah, so as you said in my introduction, I work as a general practitioner, so I'm doing that about 3 days a week. And I obviously every day that I'm doing that, I'm talking to patients about lifestyle change and particularly what would be that it be able to achieve with a more whole food plant-based eating pattern. And I spend the rest of my time doing things that I really enjoy as well. Like, for example, being one of the board directors for Doctors for Nutrition, which is an Australasian health promotion charity. As I said during my talk the other day, our vision is a society free of preventable disease, which is we think is really achievable, and many people on this summit will know is really achievable if we were to adopt a whole food plant-based eating pattern en masse. And yeah, I also spend some time doing, I suppose, other important work in our community. So I'm trying to get a medically tailored meals, program off the ground in Wellington, New Zealand. Actually, heading back to Santa Rosa in a few weeks' time to get some training for that. So really looking forward to that as well.
All right. And Santa Rosa is where True North is. Is that
Yeah, it's where Trinidad is. Yeah, and also where the McDougall program used to be.
great? Okay. And Vasanto, how about yourself?
Oh, let's see. I'm a grandma, so you're just having a bit of the old codgers today. So I'm actually 83. And so I got inspired about going plant-based after living in India for 4 years. And of course, they're really good at plant-based, well, vegetarian. They include eggs and well, mostly milk. But then I started learning about the animal problems, including with dairy cows, and also what they do with pigs, like boar bashing. I was quite traumatized to learn about that because I damaged my nose as a kid, and I really felt sorry for the pigs. So I became vegan in about 32 years ago, and that's turned out to be a really good thing to do.
Thank you. So in there's a lot of information in this conference, and it could be quite overwhelming. You get varying opinions on more of the granular level of what's important as opposed to the broad strokes. But even still, it's still gonna be overwhelming for someone to begin the process of going plant-based. I'll start with you, Vincenzo. How do we make it easy and accessible for someone to begin their journey into a whole food plant-based lifestyle?
Well, it really helps to know some other people that are doing it. And sometimes there are local websites. I'm in Vancouver, Canada, and we have a meatless meetup that has over 5,000 people in it. Well, actually got over 6,000 now. And there are all kinds of little events happening, whether they're hikes in the park that end up in a cafe or restaurant dining, or one that I've had here that is very popular. If there's any people that like to do that kind of thing, we have speakers in, and I had a vegan potluck. So people, we call it a snack luck. So it's not a real dinner. People just bring vegan foods that they like. Could be bananas if they don't want to make something, or it could be muffins or whatever. And so that's a fun one because people can listen to somebody, not for too long, half an hour to an hour, and then they can mingle, they can start dating. It cheers things up for people to find out there's more like them. And so that's a good thing. And then, of course, learning about food is typical, it's the protein. So people need to start thinking about the fact that there are 30 different types of legumes, or 20 that people commonly eat. And and then they'll go, yeah, but my mom made beans and I hated them. And there's really all these different ones. And so people can start exploring that. So there are really a lot of resources, whether it's online or in person, or just finding a buddy to start cooking with once a week, that kind of thing.
Great. So what I'm hearing is the social aspects makes it a lot more fun and easier to go, to go down that journey.
It really does. And there are a lot of resources. And of course, in our websites, NutraSpeak or Plant Powered Protein, that's plant-powered protein, we've got little webinars on there and podcasts. Probably Brenda Davis and I do a podcast, at least one of us doing one every week. And so there are really a lot of resources. And then if people look through this real truth about health, and go through some of the different things, there's all these different levels, and you find things that are fun, that are practical, friendly, inspiring.
Great. Thank you. And thank you for the shout out there. I appreciate that. And how about you, Dr. Wilson?
Yeah, I completely agree. Like, I think the social aspect of the research that we did up in Gisborne was just so important for those people that were part of it, having and also trying to get things integrated in the community as much as we could. So I definitely concur with everything you've just said about that. And then I would just add, that these changes, if it seems overwhelming, choose something that you can, do, and that can be something that seems small, but it's important to just start somewhere. And as we talked about a little bit in my talk as well, at the end of it, there's books now like Tiny Habits, like Atomic Habits, that really emphasize to people how they can make small changes, and how from these small changes and they can build into something fairly incredible in the not too long term. And one other thing I'd mention as well, which I also mentioned during my talk, was just thinking about your surroundings and thinking about your environment. So some of that is exactly the people that you are surrounding yourself with, but it can also be what kinds of foods are you surrounding yourself with at home, because we don't always have so much of an opportunity to change our own food environments in the outside of the home, but certainly in the home. Even if you've just become a little bit inspired by this, it'd be very easy to go to your fridge or your freezer now, go to your pantry, start having a look at the kinds of foods that have been discussed here as being health promoting, and make them front and center, and start thinking about some of the foods that have been discussed that are perhaps not so great, and donate them, or put them somewhere where you're not going to have access to them all the time. So just little ways that you can do things like that, I think, is a really positive way to start.
So we discussed Atomic Habits when we spoke last, and there's a quote in the book that I think is very powerful, which is, "We don't rise to the level of our goals, we fall to the level of our systems."
Mm-hmm.
And I think that kind of speaks to what you're saying about kind of like building the right environment to produce success, for sure.
Definitely.
And people can think gradually is okay. Like a
Mm-hmm.
few people will leap in, I'm going vegan, and the next day they are. I hardly ever meet any like that, but most are kind of inching their way along. Yeah. And I know I mentioned I learned vegetarian in India. Well, that was in 1978, 79. And so I've been learning stuff the whole time, and I still am. Actually, just in the last month or two, I've been learning more about long chain omega-3s. And Brenda Davis and I both got our own levels tested. And my concepts about vitamin D have been changing too. How much we need, because one of the things that's fun is nutrition is a very new field relative to some sciences. And so the first vitamin was actually identified. You know what letter that was? A. 1914. So it's just over a few years, over 100 years old. And we found vitamin B12 in about 1950, 1949. So it's really new. We're just learning things. So it's a very alive field.
What are the foods that people struggle with the most when giving up?
What do you find, Luke?
I said during my presentation, usually cheese. That's one of the
Oh
ones that,
yeah, that's
yeah.
true. Yeah.
So we had a lot of people in our study say exactly the same thing, and that I've experienced with patients and clients and things over the years is that a lot of people are cutting back on meat anyway, but it's the dairy. And even funnily enough for myself, I was, vegetarian before I became fully plant-based. And so cheese had become a bigger and bigger part of my diet.
Yeah.
So I could kind of feel their pain in some ways, but there's lots of ways that you can replace that as I talked about a little bit in my talk. And, we've got things like nutritional yeast that can give you that cheesy flavor. And over time, your taste buds adapt to not having basically cheese is, I think I said salty, it's fatty, and it's everywhere. So that's kind of
Yeah.
why we crave it. It's very high fat, and so it's hitting a lot of those. It's obviously got that umami taste to it as well, I'd say. So it's hitting a lot of our sort of senses. So yeah, that's definitely one that I find people struggle with, but there's lots of
That's
alternatives and options.
true. Yeah. And also cheese is the top of or Joseph Poor's water use charts. It's the worst of all the foods. It's way above even beef for water use. It's quite amazing. And because they take so much water to make so much milk to make cheese, and the cows, the little barn and the place that they're milking them and the trucks they're using, they all have to be really scrupulously clean. So I was amazed that cheese is number one for the water use, that we don't want in terms
Mhm.
of environmental impact. I was quite astounded by that. And second, unfortunately, are nuts. So we find, like in California, the almonds are using huge amounts of water. So even some of the vegan cheeses won't be so popular for that. Although the vegan cheeses are improving and people can move to some of them. Most are cashew based, not quite as much water use as like Miyoko really explored a lot about water use and got her cashews from, I think, North Vietnam, high in the hills. And so they were using rainwater. They weren't using water that was, through the water systems. It was interesting.
So with regard to cheese being the hardest to give up, I've heard people talk about that there's concentrated casomorphins that people are addicted to. Luke, can you speak to that?
Well, I mean, Dr. Neil Barnard's written a whole book about this. So
Mhm.
he's probably I'd say the foremost expert on cheese and the various compounds in it, though. I was in a documentary here that was about dairy called Milked, and so I did have to do a little bit of research on it. There's definitely hormones and things in there. So the idea of the casomorphins is that these are natural compounds that are found in milk that kind of give the baby cow, the calf, that kind of sort of a natural high that encourages them to feed. And so the idea is that when you get all that milk that's come from the cows and as as you just mentioned, Vasanto, like when you put it all together, you're kind of processing it and you're getting a really concentrated form of this. So you'd also theoretically at least get a concentrated source of these casomorphins. And so that's suggested to be one of the things that contributes to people's, I suppose, for lack of a better word, addiction to cheese. So that's probably part of it. But, there's other things about cheese certainly as well that are hitting, like I said, other taste and pleasure receptors and things, which probably also explain at least part of it.
Right. So based on the mounting evidence, why do you believe there is still a significant gap between the scientific consensus on the benefits of plant-based diets and the dietary recommendations that are prevalent and that are put out by our government, or pretty much all governments.
No,
I think
well, it's changing between governments.
Yeah.
You listen to Luke about, yeah, some of these things. Yeah. All
No,
right.
no, I was gonna say you should start because you've got a whole slide on this.
Okay. Well, interestingly, Canada has changed its food guide, and they actually used our Becoming Vegan Comprehensive while they were developing this food guide. Because I had done a major talk, and the director of Nutrition for Health Canada was there, and I gave him a copy of that book, and they used it while they were developing the food guide. Well, his name's Sebastian Joy in Germany, just sent me a little PowerPoint that was about countries and their food guides and how it affected health. Well, Canada developed a food guide that doesn't even have a meat group, no meat group, no dairy group. It's got the protein foods, and they're all squished in there. And it turns out that the Canada Food Guide is 88% plant foods. And there are some animal products in there. There's meat and cheese. It's actually a pretty healthy way to go. Anyway, this has affected the population. And this was the first food guide in Canada that was influenced by science instead of by the dairy lobby, which has 70, I think it's 77% of the tax money that goes towards agriculture. So this actually had an effect, and they found the same thing in Chile, in Denmark, in Finland. I think there's one other country. Anyway, oh, in Taiwan. And they have changed their food guides, and they ended up, people were getting healthier. So there's a country I haven't mentioned that hasn't got this kind of food guide. It's a big country. What do you think it is? Yeah,
Nothing comes to mind.
nothing comes to mind. Well, you're living in it. Yeah. So
Right.
they have a huge influence from the meat lobby and the meat producers in the United States. Like a huge percentage of the tax money goes towards meat, and they have a big influence on the dairy, the guidelines, the food guides in the United States. Whereas in Canada, just this last food guide was influenced by science, not by agriculture lobbies. It's a big change.
So my natural inclination as a citizen of the United States was, what allowed for that to happen in Canada and these other countries? Because it seems that there's such a hold on of industry on, regulatory capture on the regulators here in the States, that you just assume that you can't do it anywhere. So is that less true in these other countries, that they don't seem to have the level of power, so much so that they can write a guideline that cuts out meat and dairy as a class of food that they
Well,
recommend?
one change is that Canada has Medicare for everybody. So they don't want everybody getting cancer, heart disease, diabetes, because the government's going to have to pay for that. That is an influence, And so that has been one aspect. And also they had a director of Nutrition for Health Canada who was pretty plant-based himself. He wasn't vegan, but he told me his family was in that direction. Now, I went to Health Canada probably 30 years ago, and one of them told me that the dairy people would come in and kind of lean over his desk looking threatening. And it was amazing. Like they really were influenced by these food lobbies, saying, well, these poor farmers, these ranchers, they have to live too, we have to support them. Well, this one went, hey, what does the science say for health? Now, I think Luke lives in a part of the world where they have a different situation in terms of subsidies.
Yeah, well, in New Zealand, there's never been any subsidies here, as far as I'm aware, for meat and dairy, and we don't really need them because the incentives there, they actually contribute almost half of our exports, as well as half of our greenhouse gas emissions. But so there's plenty of money in meat and dairy here. In fact, that's, obviously a large part of sort of what runs the country. So there's no subsidies, but obviously there would be, yeah, I suppose, industry wanting to have a say in any guidelines and things that we were to bring out. In New Zealand, the guidelines haven't been updated since 2015, which isn't as bad as Australia, which has been since 2013. But Australia is in the process of updating theirs now. So with Doctors for Nutrition, we're really trying to make sure that there's some influence in those. And I think realistically, what's happening around the world, and I have hope that it will eventually happen in the United States too, is that despite there still being, a bone of contention, put it that way, about the health benefits, what's unquestionable is the environmental impact of animal-based foods as opposed to plant-based. And so that's something, a different angle, which all of these countries are starting to incorporate into their guidelines. So my suspicion is, regardless of, obviously we'll do our best to get a plant slant for the Australian dietary guidelines, but I think regardless of what we do, just the fact that they're reviewing it nowadays and they're looking at the evidence that's been published in the last 10, 12 years or so, they're going to be coming up with a plan that is taking environmental impact into account, and that will end up being more plant-based than it would be otherwise, regardless of everything else. So one would hope that if the American people made enough noise to get their dietary guidelines updated again, that it would have more of would reflect more what's going on in the rest of the world. I'm not sure how much they look at the rest of the world, but I know New Zealand and Australia certainly do look and see, what the Nordic guidelines are. They'll look at what Canada's done, and that gives some permission to those people who are doing this, who probably know the evidence, pretty well. But the other thing you have to remember, that these are just people. And that was what I was going to say about the same issue with why we don't necessarily get all of these things translated from research into actual action, because if the general public, there's not a feeling amongst the general public that things need to change, and that the way that things are isn't an issue, and there's not that awareness there, then there's not the pressure on politicians or even health professionals and the kinds of people who write these guidelines, and not even just the pressure, but the permission for them to actually make these changes. For example, there's huge amounts of of our culture, and that is sort of tied up in this, animal product, meat and dairy consuming, that is our norm. So in order to get people to change, in order to get the dietary guidelines to change, we need, for politicians, for dietitians, for health professionals and researchers even that are involved in these guidelines, to feel as if they can make some changes there that aren't going to upset the entire population. And obviously that's what happened in Canada. So I'm hopeful it can happen elsewhere.
We have a local member of parliament that was always, he's really nice. I really like voting for him, but he always had these big events for the public and he'd serve hot dogs. So I wrote to him a couple of years ago and said, are you really wanting your population to be eating class 1 carcinogens?
Mhm.
And I had to explain what, yeah. So he wrote back and said, well, what else can I do? He said,
Mhm.
I haven't learned anything about nutrition. He's just the most wonderful politician, but he didn't know that. And so I had to give him some ideas about what he could do. So the next time he did an event, he had half vegan hot dogs and half the other kind, meat ones. And then the last event I went to with him, he had apples and oranges. And I've lined up a company that will give him for a very good price some entirely plant-based sort of wiener type things. So anyway, it was interesting. And he wrote to me and said, or well, he told me in person, I just never learned about nutrition. I went right to grade 12 and I never learned a thing about it. So often people are surprised, and they're surprised when they're having hot dog sales for schools. And I say, hey, well, you're not giving out cigarettes on the school ground. The hot dogs are class 1 carcinogens, just like cigarettes and Roundup. And why do that for kids? And people just have not learned that kind of thing.
Yeah, so I've got multiple questions from what you guys just said. So, and I realize that neither one of you are from the United States. Do you?
Although I've lived there and I've taught at Bastyr University, and
Okay.
we've been good friends till now.
Yeah, yes, yeah. So
Really good
we won't go down
So-
that road. We're still good friends, though. We're still good friends.
Yeah.
So do you see anything hopeful in the United States that they would move their guidelines in at least in this direction, especially in the context of where, you know, we're talking about beef tallow, you know, cooking our French fries in beef tallow as a move toward health?
Well, I know McDonald's has been trying, and they managed in Britain to get a vegan hot dog kind of option. I forget, vegan burger, I think it was. Yeah, and they've tried again, and they've managed actually in some parts of the US. So I wasn't going to go to McDonald's till I'm 95 and they have an all vegan menu. So I'm not going there yet. But it is gradually changing as they find that people will buy it. So we as consumers have all this power. Now in New York schools, I went to talk there. They're serving 800,000 meals a day to kids, a huge number. They have changed to vegan on Friday, and quite a while ago, no hot dogs ever, and vegan on Mondays now. And they're figuring out things that the kids will like, you know, falafel patties, that kind of stuff, and they don't throw in the garbage, and it's given to everybody, so there's no class distinctions about who gets subsidy food. And then the hospitals, actually, they use our Kick Diabetes cookbook in New York. They have this in 7 New York hospitals, and they have the first 2 items on their menus are plant-based, and the third one might be chicken or fish. So the default menu that everybody gets is plant-based. So these food producers are learning good quantity food based on plant-based.
So I think in New York City, with regard to the no meat Mondays and Fridays, is Mayor Eric Adams, who's a longtime vegan.
That's right. Yeah, he was a cop who got type 2 diabetes. Then he turned it around with plant-based, and then his staff, he's chosen staff that will support that change, dietitians and other leaders.
So one of the cries that you hear, at least in the United States, is they want to take away our meat, right, and make us either eat bugs, eat fake meat, eat lamb-grown meat, or God forbid, vegetables. What are your thoughts on that? How do you combat that kind of thinking? I don't know if you guys would have any experience with that in your various experiences.
Well, it's probably a fairly similar kind of attitude that we'd have here, to be honest. I mean, New Zealand, as I mentioned before, it's been a large part of our economy and culture, really, meat and dairy. So uh, we do have a very strong, it's not even like a farming lobby necessarily. Pretty much everyone knows someone, you know, someone's related to someone. I've got, you know, cousin of mine's married to a dairy farmer, for example, and my both my 2 of my uncles are sheep farmers. So everyone knows someone who's part of that industry. So I guess it's still a big deal here, but I guess part of it is just generally educating people about and increasing that awareness of what we're actually asking for. So it's not just taking away, it's about increasing the variety of foods that people are getting from various sources and enjoying them. And also can be about helping farmers to transition to some of these foods as well. And the Milked documentary that I was a part of, starts to go down that road and talks to some farmers who were doing dairying and then changed because, either for, they didn't like what it was doing from an animal rights perspective, welfare perspective, or they didn't like what it was doing from an environmental perspective. So I think, yeah, I think that's not an uncommon attitude. I think just like in New Zealand, like New Zealanders, we always like to think we're exceptional. I think probably people in the United States do a little bit as well. But when you look around the world, we're not all that different. And so, even bringing it back a little bit, I've lived there for you know 2 years doing exchanges, and probably done about another half year or so. So I'm fairly familiar with what it's like over there, and it's somewhere that I do really enjoy visiting. And at one point, I was trying to get a diversity green card. That was a few years back, but anyways. So yeah, I think regarding the beef tallow and everything, that's one way of looking at it is like, how silly and stupid is this, and how unfortunate is it that there's beef tallow. The other way of looking at it, sort of the glass half full way, which I try to encourage myself to do, is at least they're thinking about diet, um, which has just not even been on the table previously. And so, yeah, I won't get into the politics of it all, but obviously there are people there who are saying that food has something to do with the chronic disease problem. And one would hope, I mean, that would be better than nothing, and it being ignored, and that maybe there will be some positive impacts that will happen. And the stuff in New York that Basanto's talked about is, that's real game changing stuff. I think that's happening there, and so hopefully that's the kind of thing that can happen the rest of the country as well. And hopefully there will be some positive outcomes coming out of this kind of interest in nutrition, rather than just the adding beef tallow back in, which is kind of it's taking us back to the 50s, really, isn't it?
So
And I don't find that many people like being told what to do.
Yeah,
Um,
100%.
so I live in a co-housing community. I showed it to, it's Vancouver co-housing. It's a Danish concept, and people own their own houses, but we have a big common house, so we can have dinner for 50 people, like everybody can come. So I know one woman told me, I don't want to hear anything about diet from you, because she knew I was vegan, of course. And then a couple years later, she had a stroke. And then she developed the best recipe in our plant-powered protein book. And with tofu, it was a tofu marinade. And I found this interestingly, when we first started out, we have common meals 3 times a week, and they only cost $5 for a meal, or $2.50 for kids. And 3 of us cook and 3 clean up. And the team decides what's going to be provided. So at first the meals were about half, and there were some beef meals, there were, fish, that kind of thing. Now I find that about 75% are plant-based. And I didn't say anything because I knew I'd get in trouble if I did. But they knew here I was at 83 bounding around and doing all kinds of stuff. And some of them aren't doing so well, or they go, huh. And we had an event on cancer, and I saw this world famous science guy peeking around the corner. Well, he'd had prostate cancer, and like there was no way that he was going to give up meat and alcohol, but he still peeked around the corner, had a good speaker come, and eventually, but it's taken him time, to adopt these changes, because they were things he really loved. And I think that's okay, it's a gradual thing, but people will go, hey, my grandchild has become vegan, so they have to at least learn how to prepare it, or just little things happen, and people are changing.
well, I think it's even amazing that you don't have to explain what vegan means.
That's right. we did our first book and it was completely vegan in 1993. We didn't have the word vegan in there. I'd never heard of that word, you know.
Right. I remember it being explained to me in 92, and I couldn't comprehend it, to be honest with you. So it's definitely come a long way. So how did the kids in New York who are essentially being forced not to eat meat on Monday and Friday, do you know how it's being received by the public, by the kids and their parents?
It's being well received. I mean, when I spoke at their school building there, and this was online as well, there were 345 school food service administrators in the audience when I was speaking, and they had their staff figure out things that kids like. Like kids like hummus. You can have that, you know, when they come home from school. It's really easy. They like falafels. They just find things they like and they'll gobble it up. Yeah. So it's
That's great.
working.
And I want to go back to the guidelines thing, which is what impact do the governmental guidelines actually have on how people eat?
Well, this I just got this presentation from Sebastian Joy, and he found that in Finland, Denmark, Canada, and Chile, they had actually had an impact on dietary eating patterns. I think in Canada, the meat consumption had gone down by 12% or something. Of course, it's going down for other reasons too, but the guidelines, they really help hospitals, school food systems. You know, dietitians have to work with the guidelines. So they have to have like half of the day be fruit and vegetables because that's what dietary guidelines. You run a nursing home, you got to give that. You know, you'll get in trouble with the government. So there's a lot of ways it's impacting and inspiring people. And they look at, oh yeah, that's what I'm supposed to do. Oh, I better put an apple instead of, you know, a bag of cheesies in the lunch, you know, that kind of thing.
Yeah, I'd agree with that. And so obviously, like we know that if people just followed the guidelines that were already there, would be a lot healthier. Um, and so a lot of the time the guidelines aren't followed, but at the same time, it gives permission to people in these other areas, as you mentioned, Visanto, the hospitals, for example. That's always one of the issues that we've had here because we've had goes at getting changes made here and there. Even when we're at Gisborne Hospital, can we get some changes made to the food that's being served? Well, these foods follow the guidelines. We've just had, unfortunately, a really unfortunate revamp of our food in schools program, which serves meals to children from lower socioeconomic schools,
Yeah.
and that's changed. They used to fund them, I think, to about $7 or $8 New Zealand for a meal. They've cut it down to $3 a meal. And the meals that are being served are pretty atrocious. They've sort of spawned their own sort of Instagram and and Facebook followings and so forth because of people just putting up pictures of what these meals look like, and they look fairly inedible. But anyways, that's unfortunate. But what is being said by the government that's changed these things? Oh well, it all follows the guidelines, and so the guidelines sort of give permission in these circumstances for food to be one way or another, and that filters out at least on some level to the rest of society. And I think some of those numbers that you were quoting, Vasanto, are a reflection of that, obviously. So even though it is really tempting to say, and I've been guilty of this myself on multiple occasions, and will probably continue to be, a little bit skeptical about what kind of difference it will make. It does make a difference, at least at some level.
Well, another part of what Sebastian Joy said was that the health statistics are actually following. Like we're getting slightly less heart disease, type 2 diabetes. Yeah, so in these different countries that have changed their guides, the health is following suit.
Mm, mm. I was just reading a paper this morning by Shireen Kassam, who's from Plant-Based Health Professionals UK, and I didn't realize this, but it's sort of the cost of people eating an unhealthy diet in the UK is basically the government might as well just pay for everyone to eat a healthy diet, and they would save more money, um,
That's right.
more or less. So, it's kind of got to that stage, which is quite interesting in our countries that have, um, you know, Medicare or government provided health systems, and whether someone's actually going to pick that up and run with it at some point. So that would be the ultimate. Forget the guidelines, let's just give people the food. And then if they want to eat other things as well, okay, that's up to them. But you'd probably find most people would be sticking largely with what was provided and saving a bit of money that way. I don't know. It's real interesting to see that it's got to that point.
Wow. Okay. So because it's so expensive, the disease burden from
Yeah,
eating that diet, that if they actually just pay for everyone's food
yeah.
and give them like the plant-based diet, they would
Well, not
actually,
even a plant though. It's just like a healthy diet, but yeah,
oh, okay, that they would actually make up that money in the healthcare industry
yeah,
and expenditure there. Wow.
yeah. You're looking at about 260 billion pounds, I think it was, a year of lost due to an unhealthy diet. So, you know, yeah, it's pretty high.
I think it was one of our speakers, Dr. John Abramson, that showed a statistic where if America was paying the same rate for their health care, that there would be no deficit in the United States, which is a very contentious issue. So if so that it really is powerful about the how expensive it is for the cost of the healthcare industry for sure. Um, what are some of the common myths or misconceptions about plant-based diets that you frequently encounter, and how do you address them in an evidence-based way?
What do you find, Luke?
I've already said that the main thing I find is that people tend to just go to, if they're changing over to a plant-based diet, they tend to go to something that's very low in starch foods and just eat mostly salads, end up feeling tired and
Oh, wow.
full, and and blame it on not getting enough protein, which is possibly true, but at the same time,
Uh-huh. Yeah.
that's one of the main misconceptions that I see, is that it's just all eating salads, and people don't realize it's really interesting, because if you think about it, most of our foods, like when you change over to this way of eating, you can pretty much eat the same things as what you've always enjoyed. You just make a few adaptations to them. And so you're still having your lasagna or your pizza or your, I love Mexican food, so I'm always making Mexican food, but I just make it with beans. So, yeah, so I think it's interesting that that's the conception, but everyone assumes vegan or plant-based means, nourish
So,
bowls and yeah, and tofu and all these kinds of things that are a bit fringe and yeah, super healthy, but you don't have to go that way if you don't want to.
some of the things I find are that they still believe some of those myths from the 70s, like that you have to eat beans and grains at the same meal to get all the essential amino acids, and that plant foods lack certain amino acids, which they actually don't. The only food that lacks an amino acid is an animal product, gelatin, that's in Jello. So anyway, that isn't true. And also that soy is bad. And that was from those two guys that ate 12 or 20 servings of soy a day and got into trouble after a year of eating you shouldn't eat way too much of just a single food. And the other one is that carbohydrates are bad, because
Hmm.
it's actually about 90%, even 95% of the carbs that people eat in North America are refined, and they're causing pollution in the Gulf of Mexico. They're making people sick. They're, with the sweets, the soda pop, that kind of thing, the sugar. And carbs are really, really good. They're only in plant foods, and they're what run our brain. Like if you give up carbs and somehow just eat a keto type of diet with not very many plant foods, you'll end up feeling pretty weird in your head or have trouble navigating the world. So we do need carbs, but it's just good to get them from the fruits, the vegetables, the legumes.
Well,
Yeah.
along that line, do you hear people say in the keto world that the brain's preferred energy source are ketones?
Oh, I hear crazy things from the keto people. And that diet is actually 4.2 times as bad for the environment as vegan. It's horrible. But yeah, I saw a doctor lately talking about keto being good. It's good for people with epilepsy, and I don't think it's good for anybody else, and it's terrible for the environment. But yeah, it is a pretty crazy diet.
Yeah, I think people are often just looking for something simple that's going to solve everything, and saying that carbs are bad is, let's just cut them out, and then that fixes their problem is something that resonates, unfortunately, and is closer. I think you were saying last time we were talking, Michael, it's a lot closer to what they're already familiar with. They're familiar with cooking, a steak. They're familiar with eating a lot of cheese, and so this seems to be a real simple solution, and you do get some good short-term results. And part of that's from depleting your glycogen stores straight away. So you automatically see this big change on the scales because you lose all this water weight and you've got, probably very little energy at that point, but you're just so stoked that you've dropped a kg or two, that and something's finally working for you. And I think this is why we see people go to more and more extremes, is unfortunately, and I'm going to go have a bit of a go at your profession, Vasanto, is that for many years, the kind of dietary advice that people were getting is to eat less and move more, and just make some small little changes. And small little changes are fine to start if you know where you're heading to. But for most people, changing I would see people at the hospital in Gisborne who were literally dying because of their weight, and they would see the dietitians and they would be told, oh, can you please cut off the fat from your meat, and can you please switch from blue top milk here, which I guess is your 2% or something, to your green top milk, which is your skim milk. And so that was the kind of dietary advice that we're giving to people who are so overweight that it's really ruining their life and giving them all sorts of health problems. And so that was the kind of advice we were seeing being given by dietitians, unfortunately. And for people, it just doesn't work. And so people are keen to grasp onto anything that seems to work for them. If people have gut issues, and that, which are largely due to, perhaps some intolerances to particular foods or FODMAPs or something, and fibers, which of course can be taken out, then put back in or introduced in various amounts. Then they see someone promoting a carnivore diet, which has no fiber in it, and they start eating that, and it fixes their gut problem, which their doctors and dietitians and everyone else that's been involved in their care hasn't been able to address. But this influence has helped them with. Then in the end, who are they going to believe, and so I think this is why you see this. People like to say, particularly within the medical profession, dietetics again, we tend to be cautious, and we're obviously we have to be evidence-based. But that puts us at a real disadvantage when it comes to people who can say whatever they want. And so we often try for the middle ground, and the middle ground, as we're seeing around the world, in politics, for example, it doesn't really please anyone. And so perhaps what we need to do is be a bit more open about the fact that whole food, plant-based nutrition, with, this emphasis on being low in your salt, oil, sugars, that kind of thing, is really what's going to be helpful for people. Then we can actually see them make some of these changes for themselves and achieve some of these results, and then they'll believe it, rather than, let's do some little things.
So you
Oh, and
mentioned,
when they give up carbs, the ones they give up are ones they should give up. Like,
Mm.
but
Yeah,
whole
exactly.
food carbs are what they should be replacing.
But even the word, it's just like everyone wants to bring nutrition down into these three macronutrients.
Oh,
Everyone just
right.
wants to talk
Yeah.
about protein.
Yeah.
Everyone just wants to talk about carbs. Carbs from, I forget who says it, but someone says, the carbs from a jelly bean are quite different from the carbs in a black bean, you know? And so, but people don't want to distinguish.
That's a
And
good
people
one.
have, people struggle to distinguish between those two things.
Yeah.
Oh, carbs must be bad. And that's all the time what I hear as a doctor, as a GP. Oh, I'm cutting back carbs. I'm like, oh no.
And so sugar or so carbs have become synonymous with sugar in a lot of circles.
Mm.
So they say, oh, sugar is bad, so carbs are sugar, and therefore you shouldn't eat them. Um, and so what happens to somebody when they give up carbs in their diet? And you mentioned the carnivore, that the carnivore diet fixes the gut for certain people. But without fiber, how do they, like, without being gross, how do they even pass stool?
This one tells you like the physiology of that. I mean, obviously, eventually the stuff will get passed through, but yeah, obviously it's not going to be, I would say it's not going to be very pleasant. But for some people, that's going to be more pleasant than at least initially, than the upset they were getting from potentially from the fiber and other things that they were sensitive to in the foods. Doesn't mean it fixes it. It fixes it in the same kind of way as a keto diet fixes your insulin resistance. Well, it doesn't matter too much because you're not having any carbohydrates. They're still insulin insensitive, but if you're not eating any sugars, if you're not eating any carbs, then there's no, you've basically just removed your body from needing to do that process. And so it is with if you do a carnivore diet, well, you've removed fiber from the equation, and so your body no longer needs to digest that fiber. Is digesting fiber a healthy thing for the body to do? Yes, and that's probably one of the main things that we are deficient in as a society is fiber. And so, but does it work in the fact that they can remove that from their diet, then all of a sudden they start feeling a bit better, and then they think that's the way to go? Yeah, 100%, because for some people that will be, it will feel better than they felt before eating what they were eating before.
By the way, we've had little comments. I saw one that some of the McDonald's vegan things were not very tasty. They're kind of like rubber or something, eating cardboard. So they're getting there. Another one that just came was somebody being so grateful that you're their GP in New Zealand.
Oh.
Did you tell some of your patients that you're going to be on, or is this person just randomly on?
Oh, probably, yeah. I mean, I put it on my social media and everything.
Okay.
So
All right. All right. Great.
That's
Thank
great.
you for sharing.
Yeah.
cute.
So what happens when somebody is on a keto diet or a carnivore diet, and then they eat a carbohydrate?
Well, you absolutely need carbohydrates for your brain. So you'll you'll be in trouble if without them. But the kind of carbohydrates we're talking about, the two camps of carbohydrates, the ones that are in whole foods, and that's a
Mm.
good thing. You get a lot of other important nutrients delivered too. Or if you leave out the sugar and the refined flour, that's a good thing to leave out. I don't know. You pick up on that?
Yeah, I mean, I think that it will spike their blood sugars because they're very insulin insensitive usually by this point. Though it depends because what we know with diabetes, and that's why it's become complicated, is because any way of losing weight is going to help with that because it's basically about people storing excess fat in their muscles and liver and other organs. And so anything that does that will be, that can reduce that will be helpful. But all other things being equal on a ketogenic diet, your body is not used to handling carbohydrates, so they will still have a blood sugar spike. And again, you're not going to be used to the fiber, you're not going to be used to the carbohydrates. So probably, at least initially, you might get some kind of side effects from reintroducing that. And so this is one of the, and this is why I'm not a huge fan of FODMAPs, again, because oftentimes people just eliminate everything, then they don't put things back in, which is always how it was supposed to be. And then they end up feeling like they're insensitive to all these different kinds of foods, and it just makes life very difficult for them. And this is the same thing with these really extreme diets that basically do nothing of what the evidence shows and what we know to be healthy for people. There wouldn't be a dietitian in the world that would argue that whole grains, fruits, and vegetables are unhealthy for you. I would hope, and there certainly wouldn't be any research around that.
But we're very much funded by eggs, sugar, and dairy, our profession.
What are some of the most compelling pieces of research that have strengthened your belief in the power of whole food plant-based diets for disease prevention?
Well, I got to work with Dean Ornish back in Berkeley in, I don't know what it was, 1990. I was very privileged to get to do that. And it was impressive seeing, he was on the cover of Time magazine for turning around a belief that we had, that you couldn't change heart disease. So that was pretty impressive. And I've also been at True North, where Luke has been, and seeing the changes that people would. I remember somebody coming from Alaska, 19 years old. He said he was a junk food addict. He was 19 and he was at this place. He just wanted to retrain his eating. And I've seen so many people come and go, and they had really turned it around. So that's very inspiring. Also, of course, the Adventist health studies are excellent because they're over 90,000 people. They're over decades. They're all pretty healthy. They don't drink coffee or drink alcohol. They get some exercise, but some are carnivores, not much carnivore, but or some are vegetarian, fish eaters, and vegans. And the vegans have been coming out ahead in a lot of respects. So that was inspiring too.
Yeah,
Did
agree.
Okay.
No, I was going to say exactly the same thing. Dean Ornish's research, what Dr. Esselson's done, I know he was on just before. It's
Yeah.
somewhat of a privilege, somewhat frightening to be following up. A talk given by Ornish and Esselstyn and T. Colin Campbell. But yeah, I think those studies, also the Adventist health studies as well, I think are really helpful. And probably the other thing too, I'd say, is even the stuff that Dan Buettner has done around the blue zones. I think looking at, I know that's not research per se, but it's sometimes it's the stories and things like that that people really connect with, and just sort of showing that around the world with different genetics and quite different lifestyles. In some ways, there's the commonality of them all being. Some of them are 100% plant-based or mostly plant-based in their diet, and in that contributing to their longevity and health.
In your experience, what are some of the key factors that contribute to long-term adherence to a whole food plant-based diet?
Definitely that community aspect, I think, as Vesanto talked about so beautifully before. I think it's hard to be sort of an island, I suppose, of health amongst this sort of ocean of chronic disease, and everyone else in society perhaps swimming in a different direction, if you like. So I think it's really helpful if you can manage to get at least the people that you live with on board. It's been really helpful to me that most of my family has changed over to this way of eating as well, and that there's been friends and even colleagues now. We've got a couple of the other GPs at my clinic now that have gone plant-based, or mostly plant-based most of the time. So yeah, having that support, I think, is really important for people to be able to maintain this long term, because we're social creatures, and yeah, our support networks are really important to us. And so if everyone's doing something completely different from what we're trying to do, it's difficult to swim against that.
Oh, another thing, this Becoming Vegan Comprehensive is one that really helps people. It's fat, big fat book, but it tells people exactly what to do in terms of all the different nutrients. And so that's a textbook in Taiwan, in the US, in Canada. And it can really help with the questions that people have. And then the protein, this this one got to #1 for sustainability, but it also has really good recipes, including the one that my friend that didn't want me to tell her about nutrition, you know, her recipe's in here for what's it called? It's a tofu marinade anyway. So if you just get some good recipes, and people only need 10 recipes, like they don't need to be a real gourmet. Well, some people like being gourmets, and some like recipes that only have 5 things in them, and you can do in 10 minutes. So there's the whole spectrum. I'm more the 10-minute person. My co-author Brenda Davis is the fancy gourmet person. So together we tend to do a pretty good mix of things. And so if you just get your little 10 recipes that you really like, then you're set to go. I also would like to put a plug in for PCRM and Neil Bernard's work, because I find that he's really got a good handle on doing things with legal issues and getting in there about food guides and taking the, you know, dietary guidelines group, you know, making an impact there. I mean, he's not 100% successful yet, but he keeps going and keeps going and keeps helping people. So I really appreciate the work done by that group, because a lot of it is political, and I appreciate, you know, that they figure out the practical stuff, but they also keep chugging away on that.
Yeah, they've been publishing some fantastic research as well. I knew there was something that I was forgetting when I was listing off
Oh, yeah.
those studies and things, and that PCRM and Neil Barnard have been doing some great publications with a low-fat, whole food, plant-based diet of late. So definitely they would be other ones that I'd say are very inspiring.
In the last panel, where I was talking to Cobal Esselstyn and T. Colin Campbell, and I asked them whose work should we be looking at, that's exactly who they mentioned, was Neil Bernard. So
Yeah.
you share
Yeah.
your
Got
perspective.
there eventually.
So you mentioned nutrients. How do you address concerns about the potential for nutrient deficiencies on a plant-based diet?
Well, when I have clients, I do a nutritional analysis. So I have some clients that are like going through pregnancy, and they're from India, and their mother said, "You cannot be vegan, no way." And it really helps to tell their mother-in-law or their doctor, yes, you know, I am getting all the nutrients. I have some people that are way underweight, kind of orthorexic, and you can show them, like, you have to get more calories. It's just not working, you know. So I help people tweak things, and people don't always get it right away. You know, some people are over and they're worried they're just not getting enough. I'm not getting enough protein. You show them, hey, you're getting 170% the protein you need for your body weight and height and age and so on. And so it is something we've got to learn about. Like, we have to learn some things about it. And of course the standard diets aren't helping people be healthy either. But when we're switching to plant-based, we just do need to learn some stuff.
So we have about 4 or so minutes left. So I'd like to give each of you the opportunity for like a final word. What gives you hope for the future, with, you know, in the context of bringing health about? So Vesanto, if you want to go first.
Well, when I did an event about climate change, and I've done it for a few groups now, I was reading about the Eat Lancets and the UN's Intergovernmental Panel on Climate Change. And we really need to keep our climate emissions down to the 1.5 degrees Celsius, or we're going to be in real trouble. Like, it's going to be tragic in the world if we keep having the effects of climate change. And so dietary choice is a big part of that. It used to be that only 7% of the research, news articles would even talk about climate change. They just said, oh, you should get a different vehicle, electric one, don't fly as much, whatever. But diet is equally as important, and it is going to be a very different world if we can't limit the sustainability aspect, and keep the global warming down. So that's one of the main things, and have fun with it. Like, do enjoy, because there's great food to be had on plant-based.
Great. Thank you. You, Luke?
Yeah, I think just looking, we've talked about it a bit today, like where things have come from and where they are now, and just that even people understand what plant-based is, and all these countries that are shifting their dietary guidelines. And, like I said, at my clinic, that's half of the GPs there now that are plant-based, because these other two have changed. And so we're doing with Doctors for Nutrition, we're doing some talks at a GP education conference in Christchurch in August, and we have 4 sessions that we're going to be talking to people, other GPs, about being plant-based. And all of these things, even when we were busy doing this research and everything, just wouldn't have been possible. So I think we've come a long way, and everyone's contributing. You had 2 incredible, luminaries, pioneers of this movement on just before with you, and from the work that's been done from them, the work that's ongoing from everyone else in this space, and everyone who's part of this conference, telling people what they've learned, and sharing that with people. I think we can get there, and we can achieve great things.
Great. Thank you so much for that. So we're gonna conclude for the evening, and really appreciate your time, and the audience who it is. I don't even know what day it is. It's Thursday at 9:30. We've got 163 people staying up late to
Well,
listen.
they're at lunchtime in New Zealand, apparently.
Pretty much, yeah.
Yeah. Well, then people, yeah. So it's lunchtime. I don't even know what time it is. Where how many hours ahead is New Zealand?
I don't know. I can't remember at the top of my head what the hours are, but
he told me it was his lunch break. Yeah.
something strange like that. Yeah.
Around that, yeah. And we're 3 hours behind Pacific time. So
Great. Well, thank you for all the work that you guys do. If we can unmute the audience, please, so they can share their appreciation.
thank you. Thank you
so much.
Thank you.
Thank you.
Thank you
very
much.
Very, very much.
Great.
Awesome.
Thank you again. I really appreciate
Fun.
it.
You're a good interviewer. You're fun.
Yeah.
Thank you. I'm glad you enjoyed it. I enjoyed talking to you guys. You guys made it really easy.